right, I'm Dr. Clay Mechlin, a urologist with Urology Associates, and we're going to talk about Urolift. This is one of my patients, and he's going to give his story. He's going to talk about what his symptoms were real quickly before the procedure, what to expect right after the procedure, and now we are almost 3 years out, and he'll talk about how he's doing now. So kind of tell us before the procedure, what were some of your symptoms or problems?
Before the procedure, I was urinating up to 6-7 times an hour. I'd get up at least 4 or 5 times during the night. Sometimes I'd have to go immediately. Other times I'd stand there for a minute trying to go to urinate. Sometimes I would urinate, walk away, have to turn right back, go back. It was just constant. I mean, my life was, it was a mess at that time. I couldn't drive. Like today, I drove for my appointment, came from Overland, Columbia, no issues. In the past, I'd have to either take a cup or worry about where can I go to the restroom before I get there in a half an hour. So
Sure.
Getting on an airplane was, you worried about where your seat was, where's the restrooms at. Every time you went somewhere, where's the nearest restroom? It was just a mess. My whole life was basically a mess.
Sure. Had you tried any pills or medications?
Yes, I tried tamsulosin. I got a little bit of relief out of that, but again, the symptoms were basically the same. I mean, I was still urinating several times an hour. During the night, it helped during the night, maybe once a night after I started taking tamsulosin. I took the tamsulosin for several years. There were some side effects, a little dizziness every now and then. But the tamsulosin gave me a small amount of relief, but nothing like where I'm at now.
Sure. And then you had done some research looking at
Yes.
some of the options, and,
Yep.
and one of the things that we talked about was the prostatic urethral lift. How did you choose that as a treatment?
I chose that because of the information that I got from you, and I watched several YouTube videos of people that had that surgery previous, and a lot of them, it was hard to believe listening to them, but now I understand. But a lot of the fellas, they had no issues. Recovery was fairly simple, and the results were what I was looking for, so I went ahead and did it. And I think the alternatives, to me, this is the only alternative. I wouldn't consider anything else.
Sure. Tell us, so we did your procedure with some sedation. That's all right, I think. I don't know. Your procedure with some sedation at the surgery center.
Okay.
So you woke up afterwards. We made sure that you could urinate. Tell us kind of what you experienced those first couple weeks in recovery.
Right after the surgery, that first urination, I won't lie, it's difficult, but each one after that got easier. The recovery was fairly simple. It's been several years, it's kind of hard to remember. After the first 2 or 3 days, I was getting pretty much back to normal. After a week, the change was so miraculous, it's hard to believe how it was before as to after. But like I say, the surgery itself is a snap, but the first urination is
Sure.
just something to prepare yourself for, because it's a little rough, and then as each urination goes on, it gets easier. And the best way I can describe it, it's a burning. It feels like there's a lump coming out of your urinary tract.
Sure.
And but that was the hardest part, was the first urination. After
Sure.
that, it just got better by the day.
Sure. And typical symptoms afterwards for that first week or two, some burning when you go to the bathroom.
Yes.
May
First 2 or 3 days.
Right. May see a little blood tinged urine, all normal, but
Yes.
resolves with time.
Yeah.
So this is now almost 3 years out. Have you felt like you've maintained good relief of your symptoms?
Absolutely. It's just like after the first week or two when I was back to normal. Nothing's changed since then.
Right.
I mean, I get on a plane now. I don't worry about where my seat is. I'm in the window seat, or coming down here today, I don't worry about it. go to a restaurant and try to scope out the restroom
Sure.
anymore. I'm what I call normal. I go to the restroom 2 or 3 times a day like everybody else. I don't get up during the night. I get up, when I get up in the morning and go to the restroom, and just like I used to a long time.
Yeah,
So,
great.
I have nothing but good things to say about it.
Fantastic.
I recommend it. I wouldn't recommend doing anything else. I would go straight to this. I can't say enough about it. If you don't believe me, look at YouTube and get some other fellas.
That's right, where you get the best information.
Yeah.
Well, thank you very much
Okay.
for telling your story.
I appreciate it.